When we think about moving abroad, we think of the greener pastures, the higher salaries, and the improved safety. Those are all real, but what we don't talk about is at Tuesday evening when it's raining, you have a hard deadline at work, and then incidentally your child gets sent home from preschool because they have a temperature or because they're not feeling well, and your village is about 6,000 miles away. Hi, welcome to my channel. My name is Piliswa. I'm a South African living in Ireland for about 10 years. I thought I'd make this video for people that are thinking about moving to Ireland and just to share the unedited version and my perspective of what it is like to live in Ireland. If you're an African woman living in Ireland, or if you're thinking about moving in Ireland, then this video is for you. I'm sharing the raw, unedited version of making Ireland home, the visa tie-in, the job market hurdles, and the notorious childcare costs, and the biological tax of living in a country with no sun. Let's separate the job market into two distinct realities: landing the job versus getting your qualification recognized. I want to touch a small bit on the local Irish experience hurdle. Many Irish employers prioritize people that already have experience from either the UK or from Ireland itself. Now, this may seem like a catch-22. When you apply, you might find yourself that recruiters are asking for Irish experience. Secondly, you need to, if you work in healthcare or medical science, teaching or engineering, your home country degree might not automatically translate and allow you to practice at your previous grade from day one. So you have medical and health professional such as CORU, which is for health sciences professionals, and NMBI, which is for nurses and midwives. These have rigorous verification pathways that can take anywhere from 6 to 12 months. Now let's focus a bit on corporate and IT. While tech and finance don't require statutory licensing, you often need to adapt your resume to European formats, focusing on specific project outcomes rather than your role description. My advice would be to not wait until you get to Ireland in any other European country to start the process of verifying your qualifications or to make sure that you are registered with the correct body. Start your paperwork while you are still back home. I wanted to discuss the critical skills permit. Most of us arrive on the critical skills employment permit to Ireland. It's a great getaway, but you need to know the rules. We're generally tied to your employer for the first 2 years. So it's kind of like a professional marriage. So you want to make sure that you choose a company that actually supports working parents, because you're going to need to stick with this particular company for 2 years. The silver lining with this critical skills visa is that your spouse gets a stamp 1G, meaning they can work anywhere immediately as your spouse. And once you, as the main visa holder, reach a 24-month mark, then you can get your stamp 4, which is your permanent residency visa. That is the moment where you truly own your career here. Now, let's talk a bit about healthcare here in Ireland versus healthcare back home. Because I've only lived full-time in South Africa and Ireland, I'm only going to be comparing South Africa to Ireland. I don't have experiences of other African countries to compare with, or other European countries. As much as I've been to other European countries, I haven't lived there, so I'm only comparing South Africa to Ireland. So healthcare in Ireland is a 2-tier system and works differently from back home. You can't just walk into a hospital for a minor issue. You need to be referred to the hospital by your general practitioner, which is your GP. So your GPs are the absolute gatekeepers in Ireland. You would need to register find a clinic and register with the GP as soon as you arrive in Ireland, because many are full and they don't normally take new patients. Also, when you are negotiating your job offer, it is always wise to ask for private health insurance for your family. This is the difference between waiting months for a consultant or seeing one. You would still need to wait, but it's not as long as using the public system. Then I wanted to touch a small bit on childcare. Obviously, this video is for working moms, so let me know if there's anything that you need more clarity on based on this video, or if there's any questions that you might need answered. Now let's talk about the biggest financial shock. Well, I think it's the two biggest financial shocks are the costs of renting in Ireland and childcare. But for the purposes of this video, I will just focus on childcare. Back home, the village is your aunt or affordable help. Like in South Africa, if you're working full time, if you're in corporate, most people are able to afford even a live-in helper or a live-in nanny. Whereas in Ireland, your village is the enterprise. There's no go or CORU to take the child back to, or even the auntie next door that you could ask for help with. Even with government subsidies, you are looking at around 700 to 1,000 euro per month per child. It's basically second rent. And then there's the issue of the wait list. Like the one thing about Ireland, there's a lot of wait lists. Like you end up needing to plan a lot, because in most services you can't just walk in and avail of the service. There's a lot of waiting. So for childcare, they're about 12 to 18 months long. I'll make an example with my own child. When I found out I was pregnant, I knew that I had to kind of get quickly onto the waiting list. And so I called the child care centers that are closest to me. And the one that I had, they could only take, the one that I had access to said, like the most promising one said they could take him after he turned a year old. So this was longer than a year, because mind you, I was still pregnant when I made that call. And thankfully, after, I think when he was about 9 months maybe, they called us and they said, okay, well, in a couple of months you can bring him, we'd have space. So that is how we're able to get child. But my point is, even before you are planning to move, or while you are pregnant, or if you have your child already, as soon as you know, maybe let's say your employment has been confirmed, start Googling creches close to where you're going to live, and start emailing them and calling them and asking for your child to be put on the waiting list. Then I wanted to talk about the emotional and biological gap. A different kind of challenge sets in, really show up on the back statements. It's the silent. Most African communities are very communal based, whereas Ireland is shifting more towards being individual. It's an individualized culture where people do their own things with their nuclear families, and they stick to living in their houses, that sort of thing. So you have to go out of your way to make friends, and you have to be proactive about being friendly with people and trying to make connections. Because what may end up happening is that you may have a lot of acquaintances, but then you turn around and realize that you don't really have like your village, like friends. So you have to try to be there for people so that they are hopefully there for you as well. I also wanted to say that one thing that is quite helpful is to join different groups. Like if you like running, join a running club, and maybe like a mom's walk group, or even a digital village. For example, like there's loads of Facebook groups where you can find people, if that's what you're interested in from back home, while you try to build your community. So for example, I'm part of a group called South Africans in Cork. It's not very active, but my point still stands. Or if you're from Malawi, for example, you could say Malawians in Dublin, depending on where you are, or Ghanaians in Galway, that kind of thing. So you will find that there are pockets of people from where you come from in Ireland. It's just you have to be a bit proactive about trying to find them. So the last bit I wanted to talk about is the biological tax that you pay as a Black woman for being in Ireland. So this is the vitamin D deficiency. It was one of the biggest culture shocks for me. Well, my friend's sister, who's been living in the UK for years, told me, she warned me, she said, you need to buy your vitamin D. But I wasn't very consistent with it. But now I am a bit better. So if you're gonna go get your blood work done, most African women, you'll find that you are probably vitamin D deficient, and that comes with a plethora of problems. So it's very important then to get yourself sorted and take your vitamin D religiously, because there's no sun. I hope this video wasn't all doom and gloom, because you may be asking yourself that if it seems so challenging and so tough, why do we stay? I would say the biggest pull factor for most of us is the job security. Ireland tends to do very well in terms of employment. The unemployment rate is very low. So if you come from a country where the unemployment rate is high, then you might be willing to stick around. And also just thinking in terms of stability for the future for your child, you might see that in a first world country, they might be exposed to more opportunities than they would otherwise have been back home. Now, this point is entirely debatable. Let me know what you think about it as well. You think it would be better to maybe have the community and send your child, for example, to a school in South Africa where the fees are exorbitant, but they would get, like the same access to education and extracurricular activities that they would if they had been in a school in Europe or in a school in America. What do you think? Let me know. Lastly, if you're starting this journey, the key takeaways are: apply for childcare, join Mums in Ireland Facebook groups to find your digital diaspora. Pack your favorite spices. Don't worry about buying your coat if you come from a warm country like South Africa. You'll probably still need a warmer coat than what you can get. So just save your money and actually buy a coat here. And if you're a mom, if you're a working mom in the thick of all of this, what was your biggest surprise moving to Ireland? Let's build a village in the comments. Don't forget to subscribe to Miles and Milestone. And thank you so much for watching till now, and see you in the next one. Let me know if you found this video helpful. What did you find useful? What would you like me to touch on more? What would you like to discuss? We can discuss in the comment section, and I could make an entire video to answer those questions. Thank you so much for sticking around. Bye.